Welcome in again to Your Health, and we have just been so honored this month. It has been a joy to have Dr. Tom Wool with us, and it's amazing. He is teaching us so much about heart disease, prevention, what you can do, because we want to keep our audience alive.
Hey, and we know all the viewers we can get.
Seriously, you guys are so great out there, and we want to help you. And this time, we're going to talk about some of the things that you can do to prevent having to go to Dr. Wool.
And maintaining a healthy heart.
So let's talk about the things that each one of us can do that are going to prevent and maintain our health.
Okay, my pleasure. So we had spoken before the show began about whether or not somebody should take an aspirin every day, and that was a good question. And the answer to that is, unless you have a problem with one of your coronary arteries or some other indication, no, you really shouldn't take an aspirin. It seems innocuous, but there's always the risk of getting an ulcer and bleeding. So unless there's a clear-cut indication, studies have shown that just routine use of an aspirin is not what you want to do.
Right.
Now that's interesting.
Now is that the little baby aspirin that they call them, or a lower, lower dosage aspirin, or?
Correct. Most of the time we use a low dose of 81 milligrams a day. So when we talk about prevention, then we want to think in terms of the risk factors that we discussed in the first segment of the show.
Right.
So if you're a smoker, please stop. And that's not an easy thing to do, but what I always emphasize to patients is that the only way to quit is to quit.
That's
because tobacco smoke is so addicting. It's very difficult for most people to cut down because every cigarette furthers the addiction. And studies have shown that cigarettes may well be more addicting than cocaine.
I agree.
Really strongly
I think that is
addicting.
true. That is true.
So don't smoke. Secondly, you want to control your blood pressure. Very common. Blood pressure, for the most part, when it's high, is asymptomatic. And that's why it can be such a killer. The only way to know if you've got high blood pressure is to measure it. It's important for our patients to know that blood pressure can be controlled, but it can't be cured. And if you stop your medicine, it oftentimes rebounds and may go even higher than it was. Having abnormal lipids or high cholesterol is another major risk factor. So certainly that's where diet comes in. So a diet that's restricted in saturated fat, cholesterol, a lot of animal products is not healthy. That being said, you generally can only reduce your cholesterol 10 or 15% at most by diet alone. But now we have wonderful drugs. The mainstay are statins, which reduce the LDL or bad cholesterol. Those are very safe drugs. If they don't work, we now have another wonderful new class of drugs called the PCSK9 inhibitors that are given by injection. But they are even more potent than statins in reducing cholesterol. So another major risk factor to control is diabetes. So diabetes leads to blockages in your arteries, but once you have that, having an uncontrolled blood sugar level increases your risk of having a heart attack. So if you do have a coronary artery disease or a blockage in a heart artery and you're diabetic, you want to keep your blood sugar under control because that lessens the risk of more plaque or going on to a heart attack. Now, you can't choose your parents, so whatever they gave you, you just have to go with. But family history is certainly very important.
Genetics.
I
was thinking the other day, because I'm on a diet now, I'm trying to get a little bit slimmer, but I was thinking, the heart is pretty much the same size for everybody, isn't it? Fairly?
Correct.
Okay, so...
It's, roughly the size of your fist or a little bigger than that.
And the thought that went through my head is, my gosh, if I weigh 300 pounds, that I don't have a bigger heart to take care of that, that must be making my heart really work hard.
That is absolutely true. adipose tissue or fat is metabolically active. It has to have a blood supply. So you literally have miles of extra capillaries if you have a lot of excess
weight.
that you're carrying around. And your heart has to work hard to pump blood through all that.
So one of the other things would be stay at a good weight.
Correct.
You know, don't allow yourself to get overweight.
Correct. And while we're on that subject, you know, exercise is important. And there was finally a study published that looked at what is the optimal amount of exercise for somebody with heart disease. And the answer is about 150 minutes per week total of aerobic exercise, like walking or riding a bike, swimming. And that's
Okay.
optimal.
And you're trying to get your heart rate up.
Trying to get your heart rate
That's
up.
right.
So basically, like Jack, you were saying, even vacuuming anything, just move.
Yeah, a lot of movement.
Move.
That's right.
Move.
That's great.
Well, we cannot thank you enough for coming. I know how busy you are, and thank you so much for coming in. And to our audience, if there is anything, you know, you can call Jack's office, 277-5000. If there is anything that further,
Don't call and tell me you're having a heart attack.
No,
They'll
but-
call 911.
but we,
Because then
but
I'll have a heart attack.
seriously,
No, I know, I'm
if
just
we
kidding.
can provide some
Right.
information for you,
We will. We'd be
you know, if
happy
we
to.
could stop one person
Yes,
from having a heart attack, it would just be a great joy.
absolutely.
And thank you for taking your time to teach us how to take care of ourselves, because you've got to be responsible for your own health. Thanks for being with us, and we'll be right back.